Welcome to this presentation on the BSN program at the University of Virginia School of Nursing. My name is Clay Heisel, and I'm the Assistant Dean for Admissions and Financial Aid at the school. This is one of a series of videos on the school's YouTube channel about our academic programs, financial aid, what a clinical day involves, and profiles of students. This particular slide shows the two buildings that are part of the School of Nursing. On the left is McLeod Hall, and on the right is the Claude Moore Nursing Education Building. They are right across the street from one another on Jeanette Lancaster Way. We have classrooms in both buildings, faculty offices in both buildings, and students in both buildings. They are right adjoining the School of Medicine. We're a 2-minute walk to the main hospital at the UVA Health System, and a 5-minute walk to the historic lawn of the university designed by Thomas Jefferson. In this presentation, I'll discuss our academic program in the BSN program, what makes UVA different from other schools of nursing, and how we measure our success. This is our dean, Dr. Dori Fontaine. She's been our dean since 2008 and is the past president of the American Association of Critical Care Nurses. She's a champion of interprofessional education at UVA and elsewhere, where nursing students are learning with other health profession students. We take advantage of having the med school adjoining to us, and there are joint activities for medicine and nursing students together. Her particular research and clinical interests are improving the quality of life near the end of life. We have 4 entry points to our BSN program. One is the traditional 4-year program where we bring students directly from high school into a 4-year nursing degree. A second is for external transfers, where we bring in students from another college or university into our BSN program for a 3-year program. They come in as second-year students. The third option is for internal transfers, for students who already are at UVA in another school and want to transfer into nursing. They come in the summer between the 2nd and 3rd year. Lastly, there is the RN to BSN for students who have an associate degree or diploma in nursing from another institution and are now coming to complete their BSN degree. This graph shows the applications received for our traditional BSN program, the one straight from high school. Applications have increased greatly over the past 12 years, and in 2012 we received approximately 670 applications for an entering cohort of 67 students. The admissions office is looking for an excellent performance in a rigorous secondary school program, as well as exposure to healthcare or nursing. For transfer students, as I mentioned, we take people in as second-year students externally, regardless of the numbers of credits that you've completed, as long as you've completed at least 30 credits that are transferable. There are no course prereqs for external transfers. Internal transfers apply during their second year and would start classes in the summer between second years 2 and 3. There are particular course requirements for internal transfers, and we encourage you to come to one of our information sessions in the school for internal transfers. The dates, times, and rooms are posted on our admissions webpage. We have a limited number of spaces for both internal and external transfers. For externals, the number has ranged between 8 and 16 spaces over the past several years. For both internal and external transfers, we're looking for a strong academic record as well as exposure to healthcare and nursing. Things that make us a little bit different from the other 1,000 or so schools of nursing that are out there. One is the diversity of clinical experiences. All BSN students, traditional as well as transfer, will have clinical experiences that last a full semester in at least 6 different areas. We also spread out our curriculum over all 4 years, so that students who come to us directly from high school are taking nursing classes as first-year students. Most other nursing programs in the country are what's called a 2-and-2 model, where you do 2 years of liberal arts and prereqs, and then 2 years of nothing but nursing. We, though, do thread both the liberal arts courses and the nursing classes throughout all 4 years. We have this phenomenal research teaching hospital, a 2-minute walk from the School of Nursing. Normally, to be at such a level 1 large research teaching hospital, you need to be in a large metropolitan area like a Cleveland, a Philadelphia, a Boston, Atlanta, LA, etc. but we have this 620-bed Level 1 Trauma Center in a college town of Charlottesville, Virginia. We're a relatively small school. We have about 350 graduate students and 350 undergraduate students. So the graduating class is about 100 students apiece. So we're a very intimate number. You get to know your classmates very well. You know your faculty well, they know you. Our clinical size is 8-to-1, so that when we're sending students to the various units for their clinicals, it is 8 students and 1 faculty member. We feel this is the best way to get individualized attention for students. It's also the safest environment for our students and the patients. Lastly, we offer international opportunities. We have 3 exchange programs where students can go and spend an entire semester overseas in New Zealand, Australia, or Denmark, and then have those students come here to UVA for a full semester. For a shorter period of time, over one of the breaks in January or in summer, we have opportunities in Central America, the Caribbean, and Africa to do service or learning. One way we measure success is our NCLEX, pass rate, the percentage of students who sit for the NCLEX to become an RN and pass on their first time. We've been averaging over 90% every year for the past decade for our BSN traditional and transfer students. Secondly, you'll want to go to a place where you get jobs. Even in this slower economic market right now, over 80% of our graduating class in 2012 had jobs on graduation day. Most of our grads also go on for further graduate study. Alumni surveys have shown that over 50% have gone towards their master's degree within 10 years, with an additional 20% have done at least one course in that 10-year period. Although they don't rank undergraduate programs of nursing, they do rank graduate programs in the U.S., and UVA is currently ranked number 15th in the country. This is of about 700 schools of nursing. So we feel there's a great trickle down and trickle up of excellence of faculty and students at all levels of the school. We offer many programs for those who already are nurses, and you can learn more about those on our other profiles here on the YouTube channel, as well as on our webpage, including 10 different master's programs, 2 doctoral programs, and many postmaster's options. The application deadline for traditional applicants is November 1st for early action and January 1st for regular decision. We use the common application and as well as the UVA supplement. This will include essay questions, transcripts, a counselor letter from your counselor, from your recommender from high school, and SAT or ACT scores. We like to see 2 SAT2 scores for traditional applicants, though it is not required. It is recommended. The application deadline for transfer students is March 1st. Again, we use the common application and the transfer supplement. Please send recommendations, transcripts, and test scores for both the traditional and transfer application directly to the undergraduate admissions office. We feel that UVA is a great place to be prepared to be a great nurse. Again, thank you for listening to this presentation. We hope that you'll consider applying to UVA. I hold monthly information sessions on grounds involving with more details about our programs, the curriculum, tours of facilities, and the opportunity to meet with students in the program. The dates for these are on our admissions webpage. I also host weekly admissions chats in the school's chat room, Monday evenings at 8 p.m. Eastern Time. So it's a great time to ask your particular questions of me. Again, if there are further questions, then you can't come to one of our information sessions or one of the chats, feel free to give us a call. Many thanks.